Friends, today we're going to talk about why your beard isn't growing, why some people have a big, bushy, shovel-shaped beard while you only have 2 or 3 hairs and it really annoys you. You are looking for a way to solve this. Today we're going to figure out why this happens, why nature has blessed some people so much but not you. We will look at several options for what you can do in your current situation to grow a beard. What side effects do these therapies have? Let's look at it from the perspective of urology and andrology. What will be the price to pay? Or is it still safe if we use certain medications so that we can grow a beard with you? So watch the episode until the end. Today we will go over the main points that will allow you perhaps to have a good, thick, lush beard. Why do we need a beard? But since ancient times, it was believed that a beard is a sign of masculinity, that it is a sign of prosperity. And that's why even in ancient times there were such fake beards. It was considered prestigious to be some kind of nobleman, to be a boya. If we remember Russia, they all had beards. It's a sign that you're a real man, that you have high, well, back then they didn't know about sex hormones, high levels of testosterone. What was meant is that you have a unique character, because people who have such impressive facial hair are usually tough, strict, real men. If you imagine a caricature of a village man, you'll probably picture a man with a thick, big beard, not someone who is clean-shaven. But unfortunately, nature sometimes gives someone a beard, and someone else doesn't get one. Some people have thick beards, while others have patchy ones. And we all think nowadays there are a lot of videos coming out saying that this is because of low testosterone levels. Indeed, there are rare cases when, because a person simply has a critically low amount of sex hormones, they have problems starting from puberty itself. And indeed, the body hair isn't that thick. But most often, in fact, for 98% of those people who think about this, the reason isn't that they lack testosterone, but that it's just their genetics. What should you do? Hair follicles are usually present here, but in a dormant state. That's why there are medications that, when applied to the area where you want your beard to grow, can actually activate those follicles and make them start growing. There are even methods where a beard is transplanted from the head. There's even an actor, a Russian one for example, who had a beard transplant to look better and more natural on camera. For a person with my kind of facial hair, or with yours if you have it, it's hard for us to understand when you always want it, but you don't have it. What? You need to understand that actually sex hormones and their levels do affect, yes, really the growth of a beard. But this is often used as some kind of trick. It does affect it, but it affects the speed and intensity. Beard growth is directly linked to levels of testosterone and its active metabolite, dihydrotestosterone. Higher levels of these hormones often lead to more active beard growth, but not always increased thickness. If there were a direct correlation between the amount of beard growth, then all the bodybuilders who are on cycles, who compete, they would all just be overgrown like Chewbacca with only their eyes sticking out. That doesn't happen. On the contrary, hair that is sensitive to dihydrotestosterone, what happens to it? It falls out. Yes, something on the body might start growing more actively if they've been on it for many years. Typically, the longer you take steroids and the higher the testosterone dose, the more hair loss you experience on your head. But locally, in the beard growth area, indeed with certain drugs, you can enhance their growth and activate the hair follicles. Let's figure out what actually affects hair growth in our body. The first thing is vitamins. A vitamin deficiency can impact hair growth. The first step is to address any vitamin deficiencies. The second vitamin, often overlooked, also impacts the health and quality of hair follicles. Everywhere it's biotin, actually it's a B group vitamin. It's often called a vitamin. Iron deficiency, if you have it, it also affects the growth of your hair. Your iron and ferritin levels should be normal. We check both to ensure proper iron balance. Ideally, this should correlate with your weight. For men, it's your weight multiplied by 2. That's the ideal. Zinc deficiency not only affects your sex hormone levels, including testosterone, but also the intensity of your hair growth. With zinc deficiency, hair growth can weaken and the nourishment of hair follicles decreases. Vitamin E, it's exactly the same for skin health and hair health. Vitamin E deficiency leads to impaired functioning of the hair follicle. The secretion of skin oil depends on vitamin A. And with its deficiency, you may experience hair loss, or there may not be effective enough therapy for hair growth. But with an excess of vitamin A, the opposite can happen, alopecia, that is, hair loss caused by an overabundance of vitamins. Therefore, taking vitamins blindly without knowing their concentration in your blood is not always the right thing to do. Why did I list all these vitamins? Because if we start talking about therapy that, for example, stimulates beard growth, it might not work. If you have a deficiency, the therapy will be less effective or ineffective. Therefore, if you do decide to work on your beard and do something about it, please make sure that everything is in order in this regard. You can do this through my BioCheck project, link in video description, or at any lab offering these tests. But please, these tests should be within the normal range. If we're talking about hair health, scalp health, and proper beard growth during therapy, besides the beard, we'll also touch a bit on the topic of hair loss. There are interesting studies that really show this isn't just a toy, that a person's health is actually associated with their hair growth. The first study, men with impaired hair growth, such as alopecia and reduced beard quantity and volume, are perceived as less attractive, older, and less sexually appealing. Bald men are perceived as sick. Another study proves that people judge you in proportion to the quality and quantity of your hair. The correlation between the quality and quantity of hair with the degree of bullying. In society, 45% experience an average degree of baldness, and 79% experience bullying from peers with a high degree of baldness. And if we do have baldness, what can be done? The two main medications are Finasteride and Minoxidil. How do Finasteride and the other medication differ? Here are some facts about Finasteride. Can Finasteride increase the chances of developing erectile dysfunction? Yes, and this connection is dose dependent. A study exists that demonstrates this relationship. And the higher you increase the dose, the higher your chance of developing erectile dysfunction. The second medication is Minoxidil. By the way, Minoxidil has a very interesting history. It was originally developed for the treatment of stomach ulcers. Interestingly, Minoxidil caused hair growth. It later began being used to treat alopecia or baldness in the form of a spray, in the form of an ointment, 5 to 10 to 15%. If you compare according to the research, here is a link to this study's data. So what is more effective? It's Finasteride, it is more effective. The comparison showed an effectiveness of 80% versus 52% when a 5% Minoxidil solution was used locally. Both methods work, but through different principles. One increases blood flow, while the other affects dihydrotestosterone levels.
So with Minoxidil, I've been, roughly speaking, for about 20 to 13 years now, I've been on the maximum dose of Minoxidil.
Can they be used together? Studies show that when used together in synergy, they provide a better effect. I am attaching a link to the study. Is it possible to restore hair that has already been lost? Sometimes hair becomes thinner, the follicle closes, and the hair is already falling out. Is it possible to restore this kind of hair? In up to 66% of cases linked to the study, can this hair be restored? Many people ask, is the 5-alpha reductase inhibitor, the same Finasteride, harmful for the heart muscle? There is a study linked to it as well that shows when using aromatase inhibitors, even in the presence of testosterone, the negative effect on the myocardium increases. But in the case of using 5-alpha reductase inhibitors, on the contrary, the toxic effect on the myocardium decreases. The next interesting fact is that the level of cardiac dihydrotestosterone increases after a heart attack, and when taking 5-alpha reductase inhibitors, it also returns to normal. Finasteride has a positive effect in people who have had a myocardial infarction. It reduces the risks of developing myocardial hypertrophy. Also, Finasteride reduces the risks of developing interstitial fibrosis in the heart muscle. Link to the study, and what is the optimal dose of Finasteride? If trichologists still prescribe it and endocrinologists seem not to be against it, definitely not the one that urologists prescribe. And that's why buying a medication prescribed for a urological patient and taking it at that dose is foolish. You will get prostate sclerosis, you will get all the resulting problems, and you will end up needing surgical treatment. You may experience difficulty urinating and erectile dysfunction. Therefore, if you still decide, if your doctor, your trichologist, the person who has taken on your treatment, prescribes you this medication, then please follow the regulated dosage. The dose of Finasteride, 0.2 milligrams according to this study, reduced the maximum concentration of dihydrotestosterone in the scalp tissue. Finasteride has side effects and concealing them is unwise. If we mention that prostate gland sclerosis is a side effect of higher doses, then erectile dysfunction and ejaculation issues also occur. Here is a link to a study that confirms these facts. Minoxidil, although it is considered to work only locally, actually also has its own list of side effects. In a test tube, it acts as a weak inhibitor of 5-alpha reductase. So, basically, what is finasteride? Minoxidil has the same properties, but it is usually used locally. There are different percentages, and it is believed that 5% is less effective than 10% minoxidil. The most effective is 15% minoxidil. Research shows that there is no difference in clinical effect between these doses. You will only get more side effects, but you won't get any additional benefits. Oral and topical minoxidil are two forms of the same medication. A common question is, which one works better for hair growth? Research shows that the effectiveness is absolutely the same when it comes to addressing issues with alopecia. If using it, opt for the topical version to minimize side effects. Intriguing study. So have you finally decided to grow a beard? You consulted with your trichologist and your endocrinologist and they approved it. You saw that there were no contraindications and you decided to use either a combination or just topical minoxidil or minoxidil supplemented with small doses of finasteride. If you have no contraindications to this and you agree with the possible side effects that may occur, because I'm making this video for those who have already decided and can be talked out of it, so that it will be as effective as possible and with minimal harm to your health. Research has shown that using vitamin A doubles the effect of minoxidil. But remember, exceeding normal doses of vitamin A and going beyond the recommended limits increases and worsens alopecia. Therefore, if you use vitamin A within the normal range within your biological needs, minoxidil will work twice as effectively. The second study also shows that vitamin A has a very strong and pronounced effect on the ability of minoxidil to be absorbed. Because the blood supply improves, when you take vitamin A, your minoxidil will work more actively. If there are no contraindications, if you are aware of all possible side effects and you agree to them, if it is confirmed that you have androgenic alopecia or if you have decided to try to grow a beard, then one of the options is to use topical minoxidil 5%, either alone or in combination with microscopic doses of finasteride. The maximum dose is 1 mg. I suggest cutting it in half to 0.5 mg or even less, which is a quarter of a 1 mg tablet. And it's absolutely necessary to rule out deficiencies in vitamins, zinc and vitamin A. Taking additional vitamin A during therapy enhances the effect of the treatment you're undergoing, but only if you don't exceed the normal levels of these parameters in your blood. So, for those who asked, my answer is I'm not a specialist and I don't claim to be a trichologist, but still, there's always an andrological aspect present here. That is, any trichologist here should also understand that there are things they themselves cannot influence. Like a urologist, endocrinologist or andrologist, he should know there are things outside his expertise that a trichologist should handle. But this knowledge, thank God I don't do hair transplants, but this knowledge, which is reflected in scientific studies that I have included in this episode today, will be useful to you in order to make a decision and understand whether you are ready to risk your health for a good, beautiful beard.